Hello, everyone, and welcome to today's webinar, Practice-Based Publishing, Getting Your Public Health Findings Out into the World. Part 2, Topic, Outline, and Background. My name is Donnie Zemmel, and I'm the Project Coordinator with the Region 5 Public Health Training Center. This webinar is offered in partnership with the Journal for Public Health Management and Practice Direct, as well as the American Public Health Association Health Administration section. This second session in the four-part series will explore how to take your practice-based work and narrow it down to a specific topic, as well as we will also be providing some guidance on crafting your outline and your background. Now, before we begin, a little bit about us. The Region 5 PHTC is part of the National Public Health Learning Network. With 9 other training centers across the country, we seek to strengthen the skills of the current and future public health workforce through continuing education and student development. We encourage you to check out our other training offerings on our catalog at rvphtc.org. Now, before we begin, here are some housekeeping information. This webinar is being recorded and all participants are in a listen-only mode. We encourage you to enter your questions and comments using the chat box. We will not be using the Q&A or raise hand functions in this webinar. Depending on the question, we may type an answer back to you or save it until the Q&A portion at the end. We'll do our best to get to as many questions as possible. The slides were sent out in the reminder email earlier today. There's no continuing education credits offered for this webinar, and the recording and the slides will be available in the coming weeks. So we'll send out a notification once those are available. Now I'd like to welcome Justin Moore, the Associate Professor of Implementation Science at the Wake Forest School of Medicine, and also the Associate Editor of JPHMP. Justin will introduce our speakers and get us started for the day.
Thank you very much, Donnie. So today I'm joined by two of my colleagues, long-time colleagues actually, who've been associated with the Journal of Public Health Management and Practice for some time. The first is Cynthia Morrow. Dr. Morrow is Health Director for Roanoke City and Allegheny Health Districts of the Virginia Department of Health, also affiliated with the Virginia Tech Grillen School of Medicine and Research Institute. She's a consulting editor for the Journal of Public Health Management and Practice, and like I said, a longtime colleague with a lot of wisdom to share with you today. The other is Ross Brownson. Dr. Brownson is professor in Washington University School of Medicine and Brown School there, where he directs the Prevention Research Center. He is an editorial board member for the journal, and a longtime mentor of mine, and someone who I'm sure you're going to learn a lot from. So we have a dynamic panel today, and I look forward to hearing the comments. Next slide, please. So just a quick recap from our first webinar for those of you who are not able to attend, or for those of you who may not recall what was covered. I think the main take-homes there were that practice-based publishing is critical if we want to improve the practice and function of public health. You know, articles and research coming out of academic centers is fantastic and serves a purpose, but really understanding how things function in the real world and the challenges and roads to success when trying to implement, trying to provide the basic public health services, 10 essential services of public health. Knowing that is crucial, and a great way to disseminate that information is through the peer-reviewed literature. So it's really crucial that we hear from the people who are doing the thing and get that out into the literature. It takes a lot of effort, it takes patience, and you really have to be ready for rejection. On JPHMP Direct in the coming week, I have a post with some reflections on why rejection may happen that I hope you'll take time to read. But, it is rejection business when you get into academic publishing, and finding a way to tailor your introduction and your research question or your practice question in a way that grabs the editor's eye at the beginning and grabs the reader's eye once he or she has access to your article once it's published is really important. So, paper writing can feel very functionally distinct from your underlying work. So, you really need to think through getting from a conception of an idea to what it would look like on paper. And so, making time for writing, as we'll talk a little bit about today, is a huge challenge. But there are ways that you can kind of recycle some of your work. You can reuse, things that are products that get you there in the first place. We talked about how that grant application become a foundation for your literature search and those type of things. So, there were some good lessons there. If you haven't checked out the introductory webinar, please do so. And at the end of this, we'll talk about the forthcoming webinars. Next slide, please. But for today, our learning objectives are to, identify a publishable topic that contributes to public health practice, identify opportunities for publishing in practice. So, how do you take something that you're doing in your day job and turn it into something that is going to provide generalizable knowledge to the field? We're going to talk about distinguishing article types and the appropriateness of each to disseminating practice-based findings, and we'll have some resources around that after the webinar. And talk about how do you determine what to include in the background section based upon the nature of your work. How do you frame that introduction that leads to that either that research question, that practice question, or the objective of the manuscript. Next slide, please. So with that, I would like to pass it on to Cynthia, who's going to talk about finding a publishable topic.
Okay, great. Thanks so much. I think this is such an important question. And the first recommendation I have is to just be intentional. I can't tell you how many times people say, well, do you think this would be a good article? And I ask the question, well, what question are you trying to answer with this article? What gap are you trying to fill? And frequently there isn't a response to that. So the first step is to know what question your practice-based findings are trying to answer. The second part is how important is the question that your findings are answering. And the third, I think, is whether the question that you're answering with your paper addresses a gap. And finally, even if you are addressing a gap, how important is it to the practice of public health? And I think at the end of the day, all of this boils down to so what? So what are you trying to do? What are you trying to tell? And we're going to, wrap back up to this. And if you look at MMWRs, for example, in their summary table, it always says what is already known about the topic, what is added by this report, and what are the implications for public health practice. And that's really what I think most places are looking for when they seek a publishable topic. And I think for those of us who've been trained in public health, and that's all of us, this really isn't significantly different from doing a community health assessment where we're assessing what's out there, we're assessing what's needed, and then we're finding an approach with our community health improvement plan to how we're going to address it. So it's no different from what we do every day. It's just translating what we do every day into a publishable topic. I want to share a story. Someone recently said to me, I've had this great idea for something that you guys can publish. We have community health workers working with children who have high emergency department visits, and we're gonna show the improvement by reducing emergency department visits. And I sort of, looked at her and I said, that's great, but that's pretty well established. So what are you adding to this? I then asked her to consider what they were doing, and what their approach was and whether there was a practice-based evidence angle that she could take for that. So in that same example, I just pivoted the conversation slightly and I said, well, what if you reconsidered the question? You have some work done, and she had shared with me the approach that they were taking, but maybe rather than ask the question, does case management improve children's outcomes and reduce ED visits? Perhaps the question should be, does placing health systems, because she was with a health systems, community health workers in a school, in a high-risk school, actually increase the health system's ability to reduce preventable ED visits? And so it's the practice part of, well, how about a health system putting CHWs in schools? Maybe there's an angle there that that translates how you take good evidence and put it into practice-based evidence. So hopefully that's a clear example. And one of the challenges, of course, is that our machinery moves slowly, and it's challenging to respond to practice needs. And as someone who is on the front lines now with COVID, I am desperate to see how do our efforts right now to address inequity in vaccination efforts. So how do we take what we know is a challenge, and that's racial and ethnic disparities in health outcomes, apply it to the COVID vaccination effort, and translate that into practice-based evidence? And we know that the machinery is slow, but all of us are doing something about it right now. So if we just take that angle of, I'm doing this already, I'm already having these efforts, I'm practicing these efforts, how do I translate that into a publishable topic? And there are opportunities for us to try to turn that around and create improved practice opportunities and disseminate that new knowledge. So that's just a what we're doing every day and how we can translate that into a publishable topic.
Cynthia, sorry to interrupt. We're having some intermittent, I think, background noise. I'm not sure if there's something that might be obstructing your microphone or...
Oh, is that better?
I'm able to hear you clearly now. It's just intermittently we'll have some background noise coming through.
Oh, I'm so sorry. We do have some trucks squeaking by, so that could be part of it. I apologize. And I think that one of the things that we really want to stress here today is not necessarily creating a new wheel, but really reframing what you're already doing and seeing that different angle. And so while I talked about intentionality in the beginning, I think that there is a little bit of creativity, and we'll talk about that a little bit on the next slide as well. But what are you doing that contributes to public health improvement, practice improvement, population health improvement? Is there an innovation? Is what you're going to do, is it going to be cost advantageous? Is it just going to improve public health practice? Is it going to give it a little bit of an edge? And I think that one of the things that we're always interested in is something that you're doing that is evidence informed. Can we change that into real action and develop early adopters? And I think when we're thinking about publishable items, it's, can we translate this? Can we move this from one practice into an evidence-based practice? All right, then the next slide. And what we want you to do is consider what you're already doing. So is there something innovative in your program evaluation? Have you done a conference which may have felt low-lying fruit, but you can innovate that. You can reframe it to make it really meaningful. There's a lot of work that we all put into grant applications. Justin was mentioning earlier that rejection is part of the game. Grant applications, it's frequently part of the game that we're going to be rejected. But can we translate that grant application into a practice improvement project and something that's publishable? Is there a topic there? And I can tell you, just, at the Virginia Department of Health, some of these It's not uncommon for me to be on a conference call, especially now, and hear of one action that my colleagues are taking and think, wow, that's something that we could really translate into a publishable topic. If we have the time, and we're going to talk about that, if we have the time to do writing. So there are a lot of opportunities that we see every day. And it's just about sort of retraining our brain into how do we turn this into a publishable topic. And I think that what's really important for all of us on this call to recognize is that what we want to do is change our ability collectively to look at ways that how what we're doing to improve the health of the populations that we serve can be magnified, augmented, so that we can improve the health of communities across our country with work with our colleagues by publishing these practice-based evidence stories. And with that, I'm going to turn it over to Dr. Brownson.
Thanks, Cynthia. You hear me okay? Yeah, great. First, thanks for inviting me to join. I used to be a public health practitioner in my early days of my career, so I would say my heart is still in practice, even if my day job is in an academic institution, and pretty much all of the research that my group does is with practitioners in some form or another. So tying together those opportunities that Cynthia just mentioned, when you start to make it a reality, you have to begin to think about, okay, I've got this really interesting surveillance report that I think is something people should know about. How do I figure out if a journal might be interested? One of the early things to do is to look at the kinds of articles they publish. And you can read the journal, so you can pick up the Journal of Public Health Management and Practice, and you can scan it and see the kinds of issues, the kinds of articles they publish in every issue. And you can also look at the instructions to author and begin, everyone is different. So every journal is a little different. There's a lot of similarities. And I think here we have a few of the common things you see. The most common articles are something based on some kind of data. It's important to note that data doesn't always mean quantitative data. Data could be, a set of focus groups, or it could be a set of interviews with practitioners. It could be data you collected from a community forum of some kind. But usually articles have some kind of data in them that could involve a program evaluation, a policy evaluation. Sometimes people want to write a commentary, which tends to be less data-based and a little more, let's say, expert opinion-based. And sometimes those commentaries are tied to a set of articles already in an issue of a journal. And then sometimes they're just more free-flowing. Like there's been now thousands of commentaries about COVID. If you pick up pretty much any public health-oriented journal over the last 6 to 8 months, there's been some sort of not only data-based articles about COVID, but commentaries. And of course, now there are many, many more articles about vaccinations, and now there'll be the next series about, okay, what about the next phase of the pandemic as we get more and more people vaccinated. And then kind of an easier place to start is often a letter to an editor. Sometimes there are short research letters to editors. And those might comment on something previously in a journal, or they might be something more fresh that brings a new one. And often a letter to the editor is only a few hundred words. A typical data-based article is probably somewhere between 1,500 words and 3,000 words in the article itself. So, and then some journals publish review articles, and review articles can be very long, even 8,000 to 10,000 words, more like a book chapter. And so there are a lot of differences. And then the next slide, we show a few examples. And I'm going to show a few examples that have come out of my teams. Back when I was in the state health department, I always felt a little bit like the state health department was a data depository, and there was a lot of data in, but not enough data out. And so we started this little thing. So most of you in your states, and I know a lot of you are in the Michigan and the sort of the upper Midwest area, have a state medical journal of some kind, and ours is called Missouri Medicine. So I went to Missouri Medicine and I said, we've got all this data. And so these top two articles, one's based on mortality data, one's based on the behavioral risk factor surveillance system data. I said, could we do a monthly little short article that basically reports on some kind of surveillance data along with some public health problem in Missouri, and they jumped on it. It was pretty easy to do. I sort of moved them around to different programs that we had, and it was a really nice way to get our data out. And I will tell you, doing this stuff now, I guess, Lord, about 30 years in some kind of practice or academic world, there are a number of these short little Missouri Medicine articles that got more media attention, more attention with policymakers than any other pieces I've done, especially when you can do things that are county by county, because the counties like to kind of compare one against the other and see how do they rank with one another. The lower left-hand one here is just a little article about how local health departments can be more involved in cardiovascular disease control. I think there was a little bit of data in there, but it was a short piece in the American Journal of Public Health. And then the other one I put in here was a practice called the Practice Full Report that we did a couple of years ago. Justin helped on this and my team here. And that one was about sort of how do we do a better job of getting the word out about new science. And so it's sort of a dissemination approach that's meant not only for practitioners, but also for a broader audience. So sort of tying the opportunities that Cynthia mentioned, try to think about, are there some opportunities? And, it may be way too much to bite off to say we're going to do an article every month, but even if you set a goal of your group, your agency or your team to say, in the next 6 months or the next year, we're going to figure out a way to publish one article together. And we're going to work together to do that. We're going to find a home for it. Always reflect back on what Justin says. If the first journal you send it to doesn't want it, don't give up. The nice thing about journal articles, unlike a lot of the grant writing we do, journal articles almost always will find a home. Grant writing, sometimes it's a one-shot deal and you're done. And so that's the nice thing about journal articles and learning that. On the next slide, Justin's going to say a few words about some of the practitioner-oriented articles that have appeared in the Journal of Public Health Management and Practice.
Yeah, so here I just want to take a moment to point out a few things. One is you can definitely do it. Here we have articles, from the CDC, from the Louisiana Department of Health, from the New York City Department of Health, and from the Missouri Department of Health and Senior Services. So, 3 different levels of public health practice. Everything from, at the city level up to the national level. And all of those found a home. We were very happy to publish all of these articles. We are not the only practice-oriented journal out there. There are others, depending on especially your discipline, that might be more suitable. But here, we have everything from translating cardiovascular disease prevention research. Once again, taking a kind of a national perspective. Our upper right-hand corner, we have the Louisiana Wellness Center's program for HIV, STD prevention among gay and bisexual men and transgendered persons. So once again, this is more of a local state experience that they wrote up here. Lower left side here, we have a surveillance program monitoring the impact of the Trump administration on health of New York City residents. So once again, a very localized experience looking at kind of national, executive branch policy. And then there in Missouri, the breast cancer population screening program results in early detection and reduced treatment of healthcare costs for Medicaid. So once again, taking a state level look at how things were working there with a screening program. These articles can be found on our website. If you like access, don't be afraid to reach out to me if there's something in particular that you think that would guide your work. We have ways to provide access to an article if it's going to help you with your own work. But I think the take home here is it can be done. One of the things I hear as an editor is how daunting the process is. But there are practitioners, like I said, working at various levels of public health practice that are doing amazing work and have found the time and carved out the time to write it up to great benefit of our readership. So, if there's a take-home message here, it's that it can be done, especially if you can, partner with some of your academic friends out there. Next slide, please.
All right, thanks, Justin. So now, that's sort of the setup, and hopefully it's gotten you some information. It's got you excited about the idea that you have something you might want to write about. Now we're going to begin, I think, what we'll build on some of the next webinars that will also be coming up. And that is to begin to think about a little bit more of the nitty-gritty of writing an article. In this case, the first part of it. So one of the journals I work with called this the IMRAD setup of a typical journal article. And that's the introduction, the methods, the results, and the discussion. So we're calling the introduction here the background section. And so that is the first section of an article. And so I don't know if this metaphor is going to work. You could, Cynthia and Justin, tell me whether this works or not. But I was thinking about this, and it's a little bit like a funnel. So there's a funnel, and the top of the funnel is the general health problem that you're trying to address. So you're kind of thinking big. As you go down the funnel, you're getting a little bit more to the specific issue that you might want to address. Okay. Oh, someone said, can you stand with, IMRAD, IMRD. We're listing off the IMRAD, Introduction, Methods, Results, Discussion. That was in the chat. I just saw that pop up. Okay, so here we are with the funnel. Got the general problem at the top. You kind of go down the funnel a little. You're down here, and you're to the specific problem, and I'll talk a bit more about that. And then you're getting down on the spout of the funnel, and there's a leak in the funnel. Something that's not working. There's some water leaking out of the funnel. That's the gap in the research. That's the thing that we're trying to build on to learn more about. And then you get the bottom of the funnel, and what's going to come out of the article, what's going to come out of that funnel. And that is the beginning to set up the article. What questions are you trying to answer? What are some of the contributions? So if you think about this from the top again, so this general problem, let's say we're working on the issue that probably some of you encounter in your public health world of electronic cigarettes, or people call them electronic nicotine delivery systems. So the general problem there would be, there are emerging health problems with e-cigarettes. The rate of use of e-cigarettes is going up at a very rapid rate, more than any other kind of tobacco. There is sort of a large-scale public health burgeoning problem out there. So that's a part one. We get down to a specific issue. You might look at, here's a certain population that looks like they're using e-cigarettes at a high rate and it's going up. Maybe that's high school age youth in one of the cities in your state. And so you might drill down to that. You might find some other disparity within that population. Maybe that young boys are using more than young girls, or vice versa. For a lot of the health issues we talk about, there's going to be a disparity by racial, ethnic group, or by income group as well. Then we might go down to say, okay, if we wanted to do something about e-cigarettes in high school age youth, what are some of the approaches that we've learned about so far? Are there policy approaches, regulatory approaches that are going on? Is there something really interesting going on in your state that we're beginning to learn about that might build on something else that's going on in another part of the country? So that kind of sets it up around the context of where you are, set that up against some of the past literature there in the third part of this, begins to sort of set up the idea of that hole in the funnel, that spout you're trying to fill as you go through. If we solve this, what might be the benefits? Often if there's cost data that you can build into this background section, that's often compelling, because a lot of the public health problems we deal with every day cost a lot of money. They're cost to society as well as real dollar costs. And then the last part of this is beginning to get us to the point where we're going to do this study. We've got this opportunity. It might be something we call a natural experiment, where there's something already going on that we're learning from. It might be the kinds of research questions you're trying to answer. It might be very practice-oriented kinds of things. It's solving the issue about, if we answer this, we'll be able to solve better public health practice. It often starts with, this project seeks to, or this project sought to, or this study will do the following. Or sometimes for practitioners, it might say instead of a study or a research question, it might be an evaluation question. Often when I sort of move between the practice world and the research world, a lot of the ways you frame things are, the knowledge is very similar, but how it's framed is a little different. If I'm writing a research grant, I use all the research language. If I'm writing a more practice-oriented grant or project, you use terms that are going to be more accessible for practitioners or policymakers. And then you might say something about, how might the findings from this study be applied, or what difference might it make for public health practice? So those are the kinds of things that go into the background section. And then, of course, a really good way to look at it is to look at other articles on the same topic, or other articles like the ones that Justin just showed you about things that have been done that will help inform what would go into this first section of an article. All right, so then I think our last few slides are just going to give a few thoughts. I'll give a few, and then I'll hand it back over to Cynthia and Justin to see if they want to give some thoughts, and then we have a couple of resources, and then we'll have plenty of time for questions. I think as I was sort of thinking about this webinar today, finding the time to do this is always challenging for practitioners. There's never enough time. You're not in the position like we are in the academic world with the old publisher parish, where it really is part of your job. So it is challenging at times to carve out the time to be able to do this. And, time seems like it's kind of been on steroids under COVID, because, that whatever you had as what your quote spare time in the past has now probably disappeared for a variety of reasons because of COVID. And that might be because, I'm managing a vaccination campaign now, or I'm trying to facilitate how to get the word out about vaccinations. Or it might be that, I'm trying to homeschool 2 of my kids now, and I've suddenly, that so-called spare time I had for a little writing in the evening is soaked up. And so I think it's also good to think about that at this time, especially, start small, carve out just a little bit of time, figure something out as a team. Writing is, for most people, it's a process. It's not, I always think like 5 to 10% of the population is probably naturally gifted writers, and the rest of us have to work at it, including me. The more you do it, the easier it gets. It's easier to do it on teams. If there's someone among your team who's a really good editor, that could really help when you're putting pieces together. Often a piece that you write as a team, you can build it together. So if you carve out with a different member of your team, maybe you're each doing a little part of it, and that can make the job a little bit easier. So that's an important part. And then also think about who you might bring on if there's an academic partner. I know some of you are involved in formal academic relationships with different colleges and universities, or people who really writing is part of their day jobs. And so if you can partner there, it can really be a win-win. And, I would say, I don't know what percentage, but a significant number of the articles that my group works with have practitioners involved in some form or another. And so that can also be a really helpful approach. So let me hand back to Cynthia and see if you or Justin want to add anything to this, kind of thinking about getting this process moving.
Yeah, I think, being on the front lines right now and being overwhelmed, I do think that it's really challenging to carve out time right now. But what I do, and certainly this may not work for everybody, is I write down some ideas, and I sometimes think about where we are with COVID, however many months into it we are now. And I think about what my life was like before I had children. And I thought, I can't think of all of that free time that I used to have before I had children. Now they're grown and out of college, but I feel that way about the COVID efforts. Like it has consumed so much of our lives for those of us who are in practice, that after COVID, there's going to be this incredible amount of time that we didn't realize we had until we were in the middle of this COVID pandemic. And we fill time, right? Whatever time gap there is, we will fill it. And I think that what I'm trying to do is I'm trying to build a list of ideas for when time starts to free up again. And this is really, again, geared towards people who are actively practicing public health right now. Because I know that at the end of this, I'm going to have a little bit more time than I realized I did before this. And same thing, like after my kids were out of the house, all of a sudden there was all this time that I could do to start writing books and doing things. That's going to happen for those of us who are in practice. And so having a list of things. And the one thing I want to, while we talked about this, how slow the machine can be, the reality is that every day we are learning lessons that are going to help us protect the public's health way after COVID is nothing but a nightmare, way after it's just a bad memory. And I think it's incumbent upon us to find the time now to capture those ideas. When we can start carving out time with our partners to write it, bring the right partners on board. But know that whatever we're learning now is going to be able to improve our practice long after the pandemic. So I don't think that it's ever too late, if that makes sense. I mean, obviously we want to capture things while they're hot off the press while we can, but there's so much that we're learning right now and so much that we can apply to our post-COVID world. So just carve out that time just to jot your ideas down, do a little bit more if you can. And I can't emphasize enough what Ross was saying about partners. I'm fortunate that I'm in an academic setting as well. And some of my academic partners do have more time than I do right now. And having those partners, one, it increases the perspective, but two, they can take a bite, as Ross said. So basically, I'm just adding a little bit of layer to what Ross said. And just encouraging you that even in the times where you're feeling overwhelmed, just writing down an idea, planting that seed can have a really big impact in the future.
I think that's great advice. In fact, that's how a lot of songwriters write their songs. They jot down little thoughts and they put them in a bucket, in a can, or put them on the cloud or somewhere, and they save them. And so, jotting down those thoughts, and then when you get back to having some time, and especially when we can be back physically face to face, I think brainstorming and bringing on some partners and talking about, we always try to get, especially our early career folks, thinking about is this a good idea? How do I frame this idea? Is this something that other people would want to know about? And if so, what would they want to know, and how do we tell that story? So I think those are good thoughts, Cynthia. Justin, anything you'd like to add to this one?
Yeah, I think as a more traditional academic partner in this, I think it's important to, if you're going to make these partnerships, is to establish them early in a project's life. One of the first large grants that I was able to secure was in partnership with the state health department and a colleague there who I had known for several years, but they came with a question and they said, we've always wondered if this worked, and there's a way to get some money to do a comprehensive evaluation. Would you be willing to partner on that grant application, on that project? We wrote the grant, we got the grant. Fortunately, we executed the project, and then we published several papers on lessons learned from both, the evaluation, from how do you work together to accomplish these types of partnerships, and some other things like that. I share that to say this is, I would go to the academic partner when you don't need them, and try to involve them so that when you do need them, you have an established partnership. But that's not much different than any other partnership, right? Partnerships built upon, kind of that let's all put something together and let's all draw back from it is a great way to do it. And so if you do have a university nearby and you can find an interested partner there, getting them involved early so that when the time comes for writing, there's the established partnerships already there.
Yeah, that's great. And both of you reminded me of something that we found very, very helpful with our partners. There are roughly 180 accredited programs and schools of public health now in the U.S., so there's a lot. And every one of them, if they're delivering an MPH, those students are required to do some kind of a practice experience. We've had really great luck with people working with agencies and their practice experience that they can then turn into a publication of some kind. So, reaching out and getting to know the universities, look around. The accrediting body is the CEPH, the Council on Education and Public Health. You can look at accredited programs in your area, in your region, and there are bound to be some, because they're kind of all over the country now, except for probably just a few states in the far west. So that's another thing that I think is a really nice link that gets you connected to university. It solves an issue they want to do, which is giving their students practice experience. They might help you on a program evaluation that you could then turn into an article of some time. And a lot of those practice experiences happen over the summer. So, you could even set up for something this coming summer if that's of interest.
I see a question in the chat, so I'll take a stab at it, and then certainly Ross and Justin, feel free to jump in. I would say, first of all, 2018, 2019 data is not going to be too old a year from now. But I think that the bigger question is, what are the data? What do the data show? And is the issue that those data are addressing something that is still applicable 2 years later? Is it something that can be generalized to? So if it's a practice-based issue that improves the way you did something, that may not have a timestamp on it. Now, that being said, I will say that I've done some journal reviews for JPHMP, and the data are 10 or 15 years old, and the practice is no longer particularly relevant for that, for what we're doing today. And so I won't take another look at that. That's just too old. But if it's something this current, I would say, as long as the concept that the data are addressing is current, certainly data that are a few years old, that's not going to be a barrier. But Ross and Justin, you feel free to jump in.
Yeah, I think in general, anything within a few year window is good. We've published things that are 10 years old because we could either argue it's such a unique data set that nobody else has any data like this, or it's something like Cynthia said that hasn't really changed. Like if it's sort of, how do state legislators make decisions about which public health issues they support? And we have a large data set. We have this one data set that's almost 900 legislators, pretty unique data set. And we're still publishing off that. It's almost 10 years old now. So I think Cynthia nailed the key issues there. It's a good question.
And the only thing I can add is that it varies by journal. Some journals value immediacy more. And it's also, as both of our presenters have mentioned, it's about spinning it. COVID, hopefully, will not be that relevant here for too much longer, but vaccine-related behavior and vaccine distribution and vaccine uptake and health disparities related to vaccines and those kind of things, those are not going away, because, if you're talking about, flu, it's still relevant. If you're talking about HPV vaccines, vaccine distribution uptake and trust in the community is still going to be relevant. So you could have a data set that's 2-3 years old, and if you spin it right and you talk about the similarities with other practices, you could also make a good case for it there. So it's about framing as much as anything else.
Yeah. I had one other thought that sort of popped in my head. There have been times over the years I've been doing this where publishing with our funders has been a real benefit. So sometimes that's been with the CDC, sometimes it's been with foundations like the Robert Wood Johnson Foundation. So don't forget about that, because many of you are getting external funding for your work. And often, for example, CDC, they have some really very highly qualified public health professionals, and it's good for them to show that the work they're funding with you is getting published. A lot of the CDC work, as you know, is through cooperative agreements, which means there's a mutual cooperation and there is an opportunity there to publish. So I thought I would mention that as another opportunity where they're almost in ways sort of a quasi-academic institution, especially in parts of the CDC. Great. All right, I think maybe we just have one more slide of resources. Justin, maybe I'll let you say the words there since this is coming out of the journal.
Sure thing. So we have some resources, and a couple I want to bring your attention to. One is in partnership with, speaking of foundations, the De Beaumont Foundation. We have developed a tool called Writing in Boxes. It's an e-learning module. And what it allows you to do is to actually type into the presentation as you go through the various MRAD steps, and where it'll be like, what's your question? Type in the question. What's important about this? Type in this. So you can take notes in the presentation, and then at the end, it will spit out a text document that will compile everything for you. And they can be done independently. So if you have, say, 4 team members, you can take a different section each, and it will help you get past that blinking cursor on a white page and get you to a point of at least having an outline of your main topic sentences, and will really kind of facilitate that team writing. So I encourage you to look at that. There are some other writing resources, mostly in the form of blog posts at this point, but we also have our author guidelines. We do have some templates available. We do have some tutorials available, and we do have a online scientific writing course that we are currently developing that we hope to launch later in the year. It was something I'm doing in my spare time, so can't tell you exactly when, but we hope to have that come out soon. I'm working with a colleague of mine, Erica Martin, at Albany on that. Another one, and it's a very kind of flat document, but the Council of State and Territorial Epidemiologists offer a scientific writing toolkit. Lloyd Novick, the editor of our journal, and I wrote this in collaboration with another colleague, Teresa Onifri, and who was working in public health practice at the time. It's a very long document, but if you're really looking for some short pieces on that to get you started or to give you some context, it can be very helpful. All of these are free to access. Next slide, please. So we would love to take more questions. I do see some that are coming in for the group. So let me take a look at my notes here. So first question we have is, would you recommend some type of informal memorandum of understanding among partners to ensure everyone does their part and contributes? This is a concern when a partner well brings someone into the group that the group does not know. Probably fumbled that a little bit. So what do you think, panelists? Is it good to have a formal agreement in place? What are your thoughts? What's your experience?
You want to take that, Cynthia?
Well, I've actually never done a formal or informal MOU, I think, but I don't feel like I've been in a situation where one's been necessary. So I think it just really depends on the dynamics of the partners that you have at the table.
Yeah, I think that's true. I haven't tended to do it on this. We typically do MOUs when it's a long-term relationship with an organization or there's funding involved or both. But I would say that, maybe an intermediate that here would be an outline of so here's what we think would go into this, and this will kind of become apparent, I think, as you go through the rest of the webinars. Here's the outline. Here are the pieces we think go in that outline. Here are the partners who might contribute different pieces of this. And then, so people have okay, I'm going to be the person to write the introduction. And you can put my name by it and set a time when I'm supposed to have that in. I think that might ensure some accountability, because I think what Crystal, what you're getting at here is probably something about accountability and roles, especially if you haven't worked with people. So I think something written down is a good idea, and maybe an outline with some time milestones in it might work with that as well.
So that's an excellent segue into our next question is, how do you negotiate first authorship? If the practitioner brings in a university to help publish the practitioner's work, for example, I'll actually start with that. If it's your project, especially if you've conceived of it and, so you're bringing the data, it doesn't really matter if an academic's involved at all, it's your project. And you have the wheel on that. So you can identify authorship, I would say very early on into the process. My personal process is regardless of who I'm working with, be they practitioner authors, students, anything, especially where there's a differential of power. Um, I lay out authorship on the very first outline. It's negotiable and it can change. Sometimes you say, I'm going to take the lead on writing up the data, and I'm fine with third author on that. And then you may find that your schedule will not allow it, and that role may change, and someone else may step up. But ideally, first authorship is the majority of the work in the writing of the paper. In academic medical centers, senior author carries some weight. That's typically the last author, and the other authors fall in line by the degree of contribution. But I would say never let an academic run off with the paper, because it's your project, it's your idea. Maintain that control. But that goes back to setting out expectations, having straightforward communication, and making sure that everyone's on the same page going in. And like I said, I try to be transparent as much as I can and prevent any confusion about that, because I have been jumped on and off the line before. So it's a thing. Ross, Cynthia, any thoughts about that?
I think that was summarized well, Justin. I think having it clear from the start, I always think about who is doing most of the writing, who's putting most of the effort on this ought to be the first author. When you get to like in the stage of my career, it makes absolutely no difference where I appear in the order of authorship. So sometimes early career people, especially in the academic institution, first author makes a big difference. And even different parts of so one campus I'm on, the last author matters. The other campus, it doesn't matter at all. So it's, there's a very sort of idiosyncratic part of it as well. But, having it clear, the person who's really doing the bulk of the work, the bulk of the writing should be the first author. There are different guidelines, like there's the one called the International Committee of Medical Journal Editors, where there are different groups out there that set forth criteria for authorship. So if you ever kind of get in a bind, you can look at some of those professional guidelines that are around as well. And Justin, I suspect there's some that you follow with your journals, some overall guidance that you can probably post as well. But I think, it's always sort of a negotiation process, but the more transparency and the more you can be upfront about it, the better.
Yeah, and we follow those guidelines that you mentioned. And we actually have, questionnaires that authors complete in the process to ensure that they deserve authorship, which is another big piece of it. I say just kind of a follow-up question. Does the first author always need to be corresponding author? No, they don't. And that's where sometimes a senior author can be helpful, because say you have someone who's relatively new to the experience, having someone else designated as corresponding author can be helpful, because it may be someone who maybe did not do the bulk of the writing, but has a better appreciation for the overview of the project, for example. And so say maybe one person wrote the grant that collected the data, but that individual then let someone else take the lead on the paper. That first person would make a good corresponding author in case someone had kind of a bigger picture question about it. So they can be the same. They don't have to be the same. So another question. Same authorship question about what if you bring an academic evaluator who collects data. I don't know. This is kind of a similar question, but or similar answer to the previous question. It's like the golden rule. Whoever has the gold makes the rules. If you've hired them, those are your data. And so, it may be appropriate that your evaluator lead an evaluation type manuscript, but that decision lies with, the organization and the individuals who procured the funding to collect the data in the first place and execute the contract. Ross, Cynthia, is that pretty consistent with your experience?
Yeah, I think that the only thing that I would add, not to this particular question, but just to what has already been said, is that I know that in practice, the authorship may not be as valuable as it is in academia. And so I think there are so many different types of power dynamics. I know that especially earlier on in my career, I allowed myself to be a little bit bullied by academicians, and that's not to give academicians a bad name at all. It's just a reality that there's a lot more pressure on them. And so I think with everything, with systems thinking, with critical thinking, we have to be aware of everybody's perspective and everybody's skin in the game, and just know where you are and how important it is to you before you start the discussions, because there is a bit of a power differential there. So I think it's just situational awareness is the bottom line.
Well, and I think it goes back to the earlier point that I was hoping to make, which is, establish your partnerships early. That way, if they can be trusted in the first place. People will usually tell you who they are. And so give yourself time to listen.
I think that's such great advice.
Any other questions? I'm not seeing anything else here. Okay, I do see something. So can either of you talk about practice-based publishing projects you're currently working on? Has your progress been impacted by COVID, or has it been influenced by COVID? I'll just say I have a commentary under review in a different journal called COVID Messed Up My Research, which is all about exactly what it sounds like, how COVID messed up my research. But what's your experience? What are you working on now? Is COVID a part of it, or is it impacting it?
Yeah, it's impacted pretty much every project we have. So that is a definite yes. Everyone's different. A lot of our projects are partnerships with practitioners and policymakers. So part of it is we've just wanted to leave people alone. I guess they have more important things than being interviewed by us to give us our data when they're putting out COVID fires. So it is definitely happening on every project, and everyone is sort of taking a different approach about how to. And the good thing is a lot of our funders have been pretty forgiving about adding more time, doing no cost extensions, figuring out ways, creative in budget. More than usual, I would say our funders have been pretty supportive of trying to figure out some fixes. So yeah. Cynthia.
Well, so I have a really hard time saying no, but I will say that again, because I'm on the front lines right now, I just don't have a lot of time. So one of the projects that I'm on, it's just we've kicked that can down the road. There's no other way to say it. Another one. I'm trying to just make the time to participate. I'm not going to be an author on it, but I'm going to try to help get data for it, because I think it's a really important thing for our community, for the public health community to know about. So I think a lot of it just boils down to how valuable do you think the project is at the time, how much you think it's going to contribute to evidence-based practice or practice-based evidence, and what your time frame is, and everybody's going to have a different barometer for that.
Great. With that, I want to thank you both, Dr. Morrow, Dr. Brownson, for your time. It's been I learned stuff, so there's that. I'm sure our audience benefited as well. And with that, I will pass it back to Donnie for closing comments.
Thank you, Justin. So just as we're wrapping up here, I just wanted to let everyone know that I've put a couple things in the chat box. We'd really appreciate if you could give us some feedback on the webinar today so that we can continue to improve our future sessions in this series and other webinars that we provide for our audience. In addition, I've also put a link in the chat where you'll be able to find more information about this series. You'll be able to access the recording from the first webinar and also register for the subsequent sessions in our series. So with that, if there's any more information, don't hesitate to reach out to us. We're happy to provide, follow-up resources and information and make some contacts to be able to do what we can to help you as you progress with your practice-based publishing. So with that, thank you again to our speakers, and we hope that everyone has a great rest of the day.